Do you have any patient stories of, improvement or
Um,
anything that you remember that really kind of like strikes you?
One of my patients that I had, um, he had a neuromuscular issue. I remember him as my perfect example that I use him for everybody. Um,
Uh-huh.
so this gentleman was actually in the military. He was a young gentleman. He was a young guy, uh, around his 40 years old. He was doing push-ups, lifting weights, just the way all these military people are, perfect shaped and buff and everything. He said one day I wasn't able to do my all my push-ups, and I wasn't able to keep my activities as I did before. So he went to the doctor, and then they diagnosed him. He came for his infusion. The first day I saw him, he came with his mother. He wasn't able to turn a doorknob,
Oh,
and
that week. So he went from being super fit to not able to turn a
not able to
doorknob.
turn a doorknob. Wasn't able to
Uh-huh.
drive. He has two kids. He couldn't do all the activities with them. Besides his muscle weakness, mostly it was in his extremities. We started off. We gave him the loading dose, which is how much medication we're throwing inside of you to kind of get your body working, and it could last from 4 days to 5 days. Um, it's a long. I know it's a long stretch of time from people's lives, but once the loading dose is done, then you go into the maintenance dose, which is every 3 weeks or 4 weeks. Anyhow, this patient did his loading dose. And then after that, I believe it was about 3 to 4 treatments later, and treatments, I mean maintenance dose later, he was able to drive. He was able to turn a doorknob. He was able to go and start performing his routine exercises. When I used to see him at the center, he used to arrive before I did, and he was running in the lobby just to get his blood, his heart rate up.
But when you go from being really like an athlete to not being able to turn a doorknob, people have to think about that loss of function. And being able to the simple act of turning a doorknob again is huge progress. And then, as you said, when now that you would go, now he was running around, and but I
Yeah.
even want to talk about like those little things of the loss of things that we all take for granted, getting it back, and then of course going up from there. It's really impactful for patients themselves.
um, being having someone doing things for us kind of take our independence away. We don't realize the basic needs, the basic necessities that we all have, and grateful for, and when those start to disappear, you know it's hard. And a lot of people, they have depression because of that,
Mhm. Mhm.
and which leads to many other issues. And it's not because they want to be, it's because they're in a situation where their body kind of made them be. And we have to be there not only for their IVIG treatment. When we're there as nurses, we're listening to their stories, we're there for their emotional support, we're there to just hear them out. I know a lot of people have families, some don't, you know and they just want someone to just kind of just went to and just say, hey, this is what's going on, this is how I was, this is what I used to do. And we're there. Use therapeutic communication, listen to them, be their friend, do whatever we can to make the infusion time go by really smooth. And all the patients, they kind of end up being your friend. You know them more than you know about your own relatives. And they invite us to their homes. They feel so comfortable once we get to doing this infusion. And at times they look forward for the nurses to come so they could have someone to chat with. So yeah, I would say mental health in regards to depression, anxiety, and stuff is a part of play in this disease progress, and that needs to be considered as well when we're doing infusions. Yeah.
Do you have any other patient stories of, improvement or
Well, I have a story with one gentleman who, his disease process also was muscular neurological related. Um,
mhm.
However, he wanted instant treatment. He wanted the pain gone. He wanted to do his thing. And I I suggested to this patient, say, hey, give it a moment, give it a chance. At least it's not making you worse. It's keeping you at the baseline where you were about a year ago. The patient declined. He said, no, I don't want to. I'm going to go ahead and stop the infusion. I don't think it's helping me. 3 months later, he was worse than what he was when he resumed the infusion.
Oh.
Yeah. So, like I said, it's not a miracle drug, but it is something that's going to help. It's going to help slow down the disease process. You just have to, continue on with it and just kind of follow what your medical doctor's advice is. I know sometimes we read stuff on Google and get our doctor's degree from Google. Those are not always, it's not one size doesn't fit all kind of thing. It's a slow treatment. It's a slow, but it's gonna help. It's gonna be beneficial. And and then this patient started up again. Now he was doing well, but again, he said he decided that, oh, it's not working for him still, and he quit again.
Oh.
Right now, I do reach out to him here and there, kind of make sure he's okay, because we developed this bond friendship with our patient,
Right.
and
Right.
seems like he's actually getting worse.
That's unfortunate.
Yeah. Um, but that's your personal decision, how you want to take care of yourself. I always advise my patient that, hey, there's advertisement on TVs for this drug that, this drug will do this, but it comes along with a whole bunch of side effects. They're gonna disclose everything, even if it's like something minor. But you got to realize, if this is something that's going to help you, give it a chance. Don't let it scare you, you know?
And one patient might get back to their previous level of functioning. One patient might just maintain. One patient might get some things back. And so you can't compare yourself necessarily to any other patient, because if you're maintaining or even just slowing your progression, that's progress. And it can be hard for patients to accept. And of course, that's where a nurse who is also a friend of patients can listen to that kind of grief sometimes, as well as the victories too.
Yeah. And losing your abilities, your, lifestyle is kind of like grieving. When someone passes away, you go through this grieving stages where you're in denial, you're angry, so forth. Same thing happens when you're not getting what you had, you know, and you start thinking about it, and then you start thinking about your past and how you could have fixed it, or what. But sometimes it's not you. It's just your body genetically programmed this way. And now with the technology, modern technology, medical technologies, we're trying to figure out new ways to kind of help help our body, stop doing what it's doing, or need to go back in regular function. Of course, I mean, with this new age, new scientific methods that are coming out, with this whole COVID, for example, vaccines developed in such a fast amount of time. These are all, science and research. We just gotta do our best to kind of follow up with these and do whatever we can, um, and have some faith in it, and not blame yourself, because all you're doing is putting pressure on your body, making you more depression, more um, discomfort. Rather, think positive energy.
Absolutely,
You
yeah.
always gotta, I tell my patients, gotta have positive energy. Bring that positive energy. You don't want that negative energy around you, or in you. And you know what? I see patients, and I see that, I say, hey, Noorali, positive thinking. We're gonna get through this infusion. It's gonna go well. We're not gonna have any issues. We're gonna do this. That's how we start off, and that's how I want everyone to think. Like, let's do this. This is for my benefit. We're gonna make this happen. It's gonna help. It's gonna help. I'm gonna use this. I'm gonna use my positive energy to rebuild my body.
And absolutely, and I know myself being an IG patient, I am still an athlete. I am a very different athlete than I was previously, and I'm okay with that because I still get to do really amazing things. But I had to also get to go through that place of grief and get to that place of acceptance of, oh, now I just gonna do, I still can do things. I just do them differently. But I'm just having a really great time in my life, even though it's completely changed from what it was.
Yeah. No, definitely. It's a hard process. And anything that changes out of the norm is a hard process. Um, and many of the time, we kind of become dependent on things where we're not thinking out of the box. We're not thinking, okay, we have this ability. We should be thankful, but how can we improve or help others? And you're doing that. You're helping others after, you realize yourself how to handle this disease process. So those are kind of things you always have to be, grateful for and, be happy about, you know.
It's different. It's a different way to live when you're diagnosed with a chronic illness. And one of the great things I have, and an IVIG virtual group going on, and they really encourage each other. And if they have they just give each other encouragement. And if they have a tough infusion, they kind of just lift each other up, and it's I really just sit back and listen, and
Yeah.
it's great to have them interact and be able to give each other encouragement, and that's something to keep in touch with your nurses. And I've got patients who have amazing family and friends, and they said, but it's really great to be able to talk to other patients because even though I have an amazing support system, they just don't get this part.
Yes, yes. For family, they don't, they're not they're there. They know how the patient is, but inside what the patient's feeling, no one can express it except for the person that actually has something similar going on in their life and their health. Um, for example, I have this patient, renowned hand surgeon. He's an old gentleman, but he tells me his stories about his surgery days and how he used to treat all these people and stuff. He he is in so much denial and grieving that he's not able to do what he enjoyed doing. He's not even able to keep his hands steady because of the tremors, his gait, imbalanced gait. But at one point, he was even thinking about stopping IVIG. We discussed it, said, okay. He went, talked to his doctor, and this is at one of the infusion centers. And the doctor, after he came back out from his doctor's office, he goes, we're going to resume the IVIG. And this time I'm going to put more positive energy, like you said. And, and every time I see him, he has a smile and he goes, today I did my bike yesterday, I feel better and I'm going to keep doing it. And it's just what you bring in, is what you're going to put out. So more positive energy, you're going to bring in more positive energy, you're going to put out, and that's going to be good for you, your family, your friends, your work environment. And then that's going to motivate you. Like for this guy, he's doing bicycling, even though he's in his late 80s, he's trying to his best to bicycle. Um, Gardening helps, now he's okay. He's like, okay, now he's acceptance that, okay, I might not be a renowned hand surgeon anymore, but I am biking. I'm with my family. I'm gardening. I'm me. I'm retired. I'm enjoying it. I'm going to get my body to be the best I can.
And that's really great. And I remind some of my patients that are older who have this idea that they should do these things, and it's like, is that what you did when you were 30? And
Yeah.
so I'm like, you're older and you're doing these amazing things exercise wise and movement that the healthiest of people that are in their senior years aren't doing.
Yeah, I
So
don't go ahead.
so
You
sometimes
know,
they forget. Sometimes patients can also be overachievers, but they don't notice how well they're doing. And I
yeah.
will sometimes simply point out, and they're like, "Oh, oh." And sometimes an outside observer is the best gauge of how well people are doing.
Yeah.
So
Yeah, and actually, he's kind of challenged me to go on a do bicycling too. So, I do take my kids bicycling now and then, and I think about him because it's not the patient always thinking about the nurse. The nurse also thinks about the patient and how he has said, "Hey, do this; it'll help," you know. And I did get a bicycle, and we're doing bicycling on and off
good for
now too.
you.
So he encouraged me. So you could encourage your nurse too. For certain
And
things.
that's actually really important to say because patients sometimes think they don't have an effect on the people who care for them medically, and they absolutely they do.
Yeah, all my patients have a special place in my heart, um, and I always wish the best for them. And I hope for everyone to be healthy and be happy. This life is a short journey, so we want to live it the best we can with happiness and support from everyone around us.
So when patients show up to you, do they even know what IVIG is? Has their doctor told them what the medication is, or do they just it's like, okay, I'm doing an infusion? Do the majority of patients know what IVIG is, what the side effects are, what it's supposed to do for them, how long they're supposed to be on this treatment? Like, are they given good education about what the prescription is and like prognosis and length of time? Do you help patients with that, or do you refer them somewhere to read
And
information, or what do you
well,
how do you help that with that?
when I see them, I go through and explain to them like the basic terms as best as I can. So like the lock in, the key theory that I that
Mhm.
I you know that I kind of told you about. But after the doctor goes to the pharmacy, the pharmacists they're like the middle person also, and they kind of say, okay, we're going to send you the medication. It's going to be this many hours, so forth, so forth. um, but I think when it gets to the nitty gritty part, I think that's where the nurses kind of go and say, okay, the process of how this works is this is derived from a plasma which contains a lot of antibodies. And they're like, oh, well, what's an antibody? Like, then you have to go more break it down into the lock and key system of the body, kind of layman terms. Say, well, once these antibodies are introduced into your blood, we don't know which one, but one of those keys will fit one of those locks, and whatever is causing this discomfort, muscle weakness, nerve breakdown, is going to stop or is going to reduce it. And we have to keep flooding your system with these keys to make sure that those locks are remained closed or open or whatever it needs to do in your immune system where your antibody's supposed to do it.
And
Uh,
I know with the majority of patients who are on IVIG, are you on it usually long term? Do patients show up to you knowing that this infusion is probably going to be a long term medication for them, something they're going to have to do? I mean,
a lot,
it's variable, but it's not one of those things, an infusion where you do it once a year and you know.
yeah, it varies upon patients when they feel the symptoms. For example, I had a patient who was started off every 4 weeks. But he said towards the third week, he started to feel weakness and, his muscles were like more cramped. So then they switched his treatment plan to every 3 weeks because that's
Mhm.
when his body says, okay, it's time for you to juice me up again. So the patient sometimes knows that, okay, it's time for me to get this treatment because I'm feeling the effects again, and the doctors will make the adjustments and say, okay, now instead of doing 4 weeks, we're going to do 3 weeks. It just depends on each individual. As long as how long the treatment goes, there's prescriptions written for 6 months or 6 month treatments. There's ones for 1 year. And then there's one that automatically renews year after year and year, and people are just using it as a lifetime. Let's say you're in your 90s and you're like, okay, I'm done doing this treatment, and it's not going to get me any better, or it's not going to do anything for me. The doctors reevaluate you, and if they I would suggest you get it reevaluated every year. You want to see what the progression from last year baseline, what your Ig level and your blood work was from previous levels versus now, and kind of keep track. You as a patient have to be in control of your own health as well. Don't rely on the medical professions only, because they have so many other patients, and they're good people. The doctors are good, nurses are good. We all try to help out, but they're, it's not intentionally that they forget you. It's something you just say, hey, I want to make sure I get reevaluated. Is this treatment the way to go? Do I need more dosage? Maybe the dosage amount that is written for me because of my weight is not correct. Maybe I need more. And those are some things the doctor and you can agree on. Maybe you'll need less. Maybe say, hey, you know what? Instead of 40 grams, let's do 30 grams. And also, I know patients don't know how long the treatment is, what other options they have. So IVIG can be done through a peripheral IV where they put a needle in your vein, or you
Mhm.
could get it done through the subcutaneous level, which is the fat on your body, which you do it at your by yourself, or you can, the nurse will train you once or twice or however many times needed. But this is more for like doing it independently, while you're watching TV. You don't want to be, stuck with a nurse for 9 hours, 8 hours, 6 hours, whatever time frame you have set for the infusion. If you're on the go type of person and you're traveling, sub-Q IG is something that you should also talk to your doctor about. I know they don't always mention that, but that is some options that you do have. With the sub-Q, you kind of, inject your fatty layers and you have the little pump with you. And then you could walk around and, do whatever. Or if you're, watching TV or at your bedtime or something, just laying in bed, something on your timing. The process is almost similar with actually less side effects. However, getting it through the IV through your veins, I feel, and actually have a patient who moved from sub-Q to IV has resulted in better results than getting it through the sub-Q. From my opinion and from what I've seen with the patient. Of course, the books have this where it says it's the same treatment process. And then if you're afraid of needles, I probably would not go with the sub-Q because you're gonna get like 8 needles that
Yeah.
you have to secure in, and I'd rather go with the one-shot IV. And you could always request your doctor to write you a prescription for like lidocaine, topical lidocaine, kind of numb the area before getting an IV inserted. Or even if you do sub-Q, you could also get lidocaine for that too.
When we think about patients, and this can be some time, 6 months, a year, or longer duration of having to infuse, what are some of the reasons patients discontinue their IVIG treatment?
So some of the reasons a patient discontinues is because they're impatient. They want instant results, and like one of the patients I mentioned earlier wanted instant result, and you know decided not to continue. Other reasons are they feel like it's interfering with their lifestyle, like whether it's a 4 hour infusion, whether it's a 9 hour infusion, it's taking up your day, your time. And we know you guys want to be out and about and be with your families or do do your chores or whatever you guys need to do. Third reason is the side effects. Some people are like, no, this is the headache is just too much for me, or pain from the IV in the arm is, I can't deal with it. I don't want any more needle sticks. Or some people actually have concerns where they're like, well, I really don't want the nurse to come over because of the COVID. I'd rather not get COVID and be safe by not having anyone come to my house. And those are some of the concerns that patients have shown where they kind of stop wanting to do infusions.
I know patients I've spoken to, the most common reason they want to discontinue is that it's just time consuming and it feels never ending. And as you said, they want to get back out in life. But as you had talked about that one patient who discontinued and would get worse, when people talk about being on infusions long term, people don't really understand that process. And because a lot of these diseases are ones that people haven't heard of, it's really great for you to be able to have explained that so people just in general can have more knowledge. Family members, support people, friends, anyone they even know who's on an immune globulin product. It's thank you just for explaining that because it's confusing.
It is. It is. I mean, basic medication, like, here, take this. You're gonna, okay, well, no one tells them they're gonna be peeing all the time. So a
Right.
little bit, a little bit of education, a little bit of support, a little bit of comfort goes a long way. Um, and as a team of nurses, pharmacy, doctors, we're here to help you guys and feel better. And then remember, yeah, and all your questions are smart questions. There's no such thing as dumb questions. You've probably heard this throughout grade school and stuff. There's
Right.
no dumb question. And it's the same thing here in the medical profession too. We all don't know all the answers and questions. So it's ask, ask. One person will know. If it's not the first person, the second person will know. So don't give up on your question. If you still have that question lingering around, call someone, find out, get that question answered, because this is all about you. I know a lot of people, they think IVIG takes away a lot of their time, but just remember, investment in a little bit of time can be very much beneficial for later on. So just enjoy your infusions, watch some Netflix, catch up on those shows, relax, take a nap. We're here as nurses to monitor you and take care of you, and never feel like you're troubling the nurses for anything. Call them, talk to them, stay in the loop, and as a team, we could do our best to make you guys feel better and comfortable doing infusions. In my own personal note, I wish I knew about IVIG so I could have introduced it to my mother. Unfortunately, she's no longer with us, but I would have definitely tried IVIG on her, and I think it would have made a lot of difference, and she would probably still be here if we would have done that.